kind of part B of it.
It's part B of it, but they could give up car check theoretically and still get mandatory arbitration and some sort of compromise.
Right, yeah.
And
compromise.
right. And you know, if you had to pick one, you'd rather have a car check without mandatory arbitration.
Right.
So, but you know, I think that, you know, our attitude has always been that if we do the right things by our employees, they tend not to choose unions because management's behaving appropriately and taking care of them. And for us, actually, even in this rate environment and the hit that we're going to take economically next year, we're actually going to be improving our benefit package for the majority, not all, but for the majority of our employees. Mm-hmm. So, you know, we're trying to be real mindful of that.
Okay. And one thing I've never really understood, even with decent Medicare rates compared to Medicaid rates, skilled nursing facilities, I mean, it's a good business, but skilled nursing facilities have never been a high margin business. I mean, it's, you know, after taxes, after everything, it's always been on, you know, earning $1 or $2, $3 on every dollar, every $100 of revenue. Why is it that Washington doesn't get that it's such a tightly run, low margin business?
Well, I think actually, I think Washington gets it better than you might think, because if you really look at the years since BBA, for example, which, you know, frankly, this last decade, I think, is the first time in the history of our sector where we've actually had sort of a consolidated and organized effort to try to educate and get our message across to DC. And so really what you've seen these last 7 or 8 years are market baskets every year consistently, regardless of what MedPAC recommends. Relatively consistent Medicaid rate increases. And so we're able to maintain that sort of low margin business. But our whole educational thing with the Hill is you can't just look at Medicare margins, you have to look at total margins. And the Republicans have been in control for so long that they really understood that. And our challenge when the Democrats took control was to start over with that same educational process, because they really hadn't been in control of Congress for a very long time, since pre-BBA really. And these last 2 years, MedPAC made the same recommendation it always does: market basket freeze, and Congress allowed CMS to push through the market basket for us anyway. So that boded well for us, you know, relative to us believing that people were understanding it. And if you talk to leadership in the House and the Senate, they do understand that now. We'd really like to, and are trying to work with leadership on the Hill to broaden the MedPAC charter, whether it's the current MedPAC or newly envisioned sort of super MedPAC, to consider total margins when they make their recommendations, and not just Medicare margins, and not just for us, but for everybody. I mean, we're a little bit more unique because there isn't another healthcare sector that takes care of as many of the indigent elderly as we do.
Well, as I heard this afternoon with that, you know, what was it, the 594th Amendment, whatever that was passed in the Baucus bill.
Correct, the Wyden Amendment.
Right, where they're going to have, you know, if you're going to have to take into account Medicaid with the Medicare, which was, as he said, that was the first time that's ever happened. Correct.
We've worked, I think, really hard to try to make that happen, and we're very appreciative, actually, of the support that we've gotten, both in the Senate and the House on that.
Good. So, you know, the healthcare system in this country is going to have a lot of changes. You know, Medicare for everyone is going to change to some degree. With all this happening, do you think there's going to be some sort of structural change in the skilled nursing business? You know, how you get paid, who the patients are, short-term versus long-term. Do you see something really kind of evolving over the next 5 or 10 years for a new kind of skilled nursing industry?
Well, I think 2 answers to that. One, I do see something evolving, because I think there is a commitment, might be too strong a word, but certainly a focus by CMS to push towards more of a uniform, neutral site payment system for the post-acute sector in total. And I think that's one of the purposes of the demonstration project, testing this uniform patient assessment tool. So in other words, the rate at which a patient you get reimbursed for taking care of a patient should be based on their condition, their diagnosis, not on the setting that they're in. And that's something that we would be supportive of. But above and beyond that, our group has developed a, I think, very well thought out, complete reform of the long-term care financial system. not just for nursing homes, but for post-acute care and generally, and is very even-handed in terms of how it treats anybody. So it's not nursing home oriented, because we knew that would never pass muster. And we have begun to introduce that to leadership on the Hill, and basically been told, we need to get through all this stuff first. We don't really have time to get to you guys right now, but as soon as we get through this, we're interested in looking at your proposal. And so we have gotten it to some key people, but we will, once we get through healthcare reform, we'll be focused on trying to more aggressively introduce that, because even if at the end of the day, however it turns out, looks something somewhat different, which I'm sure it will, than what we're trying to introduce, what we're really trying to accomplish here is to come across, because we believe it, that we want to be part of the solution. They're looking for help on the Hill. You know,
They are looking for help?
yeah.
Okay.
You know, they're looking for ideas and they're looking for feedback, and so we want to be part of the solution. We don't want to just, you know, be an industry that's sitting there saying, you know, don't cut us or give us more. You know, so we're trying to be a lot more proactive than historically this industry's ever been.
That's good. Now, I've known you for, I'd say, almost 20 years or so.
Right.
And I remember years ago, I always thought of you as the pioneer for managed care and skilled nursing facilities in California. I mean, I think you probably have the highest managed care census of any large nursing home company. This was your company prior to Sun.
Right.
And it was, I mean, you got it. When managed care came in, you understood it. You understood how to deal with them in the skilled nursing business. We don't hear about managed care at all anymore. It's all Medicare. What's happened with managed care and the skilled nursing industry? Is that just blown away?
No, I think you'll start hearing more about it now, because post the end of the last decade, managed care and nursing homes kind of fell apart. First of all, from a pricing perspective, it became untenable, and a lot of us stopped doing business with managed care providers. And then most of the managed care providers got out of the business. For a long period of time, the only managed care provider of note that was still in business was Pacific Care with their Secure Horizons product. I mean, everybody else was just out of the business. That's really what happened. There was no one even providing product. With the advent of Medicare Advantage, it's starting to become much stronger. And while our managed care, from a census perspective, is only about 3.5% of our patients, that's double what it was 2.5 years ago. And in our centers where we have these rehab recovery suites, which we're more focused on the short stay patient, our managed care census is double what it is in the rest of the company. And in those units themselves, it's actually over 15%. So we're being a lot more aggressive working with the Medicare Advantage players out there, and because those patients, the rate isn't quite as high as the Medicare Part A rate, but it's still a pretty good rate, and we get acknowledged for the acuity that we provide. So as long as we were able to take care of higher acuity patients, we get better rates. And so I think that's something that you'll see a lot of us going after a lot more aggressively. One of the things that happened with us was we were starting to get more aggressive with it, and then when we did the Harborside acquisition, Harborside just stayed away from managed care completely, so it really diluted our numbers. And so it's almost been starting from scratch since we did that deal 2.5 years ago, because that's about 1/3 of the company, to sort of get that going and teach everybody again.
So what happens if, everyone in Congress is talking about cutting the Medicare Advantage rates, and so if half of Medicare Advantage disappears, does that kind of take you off the track of managed care with them? That's where it is?
Yeah, I don't think half or anything like that's going to disappear. Managed care, Medicare Advantage plans do pretty well. They may not want to take a rate cut, no one does, but I think they're still going to be in pretty decent shape. The question is, if Medicare A gets cut, is that passed through to Medicare Advantage? Does that impact us? Because a lot of the Medicare Advantage contracts are based on RUGs rates, and I think it just depends on the managed care provider that you're doing business with. There are certain managed care providers that are going to say, if we're getting cut, we're cutting our rates to you. And so then the question is it still going to be worth it for you to do business with them? Are there other managed care providers in that community that you can do business with? But then there are other managed care providers that actually have an attitude that's more like, look, our biggest cost is the acute hospital and utilization within the acute hospital. And you guys can help us get that down if you can take this classification of patients 3 days sooner. And so, I think what you will see is us being a little bit more particular about who we do business with. If in fact there are Medicare Advantage players out there who just want to pass it on to us, as opposed to those who see us as helping them solve their bigger problem.
Gotcha. All right, well, that's been very informative. Thank you very much for sitting down with me.
Thanks, anytime.